Hello, everybody, and welcome back to Getting to Know You. I am your host, Jen Dawson, PeDRA's Associate Director of Educational Programs. This is episode 2 in season 3, and I am delighted to be joined by Dr. Jerome Coulombe. He is an associate professor of pediatrics and dermatology at Saint Justine in Montreal. Thank you so much for being here.
Thank you for having me. Happy New Year.
Thank you. Happy New Year to you as well. So as we get started, why don't you tell everybody how you became a pediatric dermatologist? What led you to this career path?
Pediatric dermatology because it's always really fun and so rewarding to work with kids. But when I did my medicine studies, I wanted to be a family doctor. But after that, I discovered dermatology like in a clinic, in an elective, like really by chance, and I was took over by like the feeling of being a detective and looking at the lesions and finding right away the diagnosis. And I always balanced my love for pediatrics and dermatology, and I met a great team here in Saint Justine that just consolidated like my interest for dermatology and also the fun of working with kids. I'm pretty lucky to work with my team here. Yeah.
That's great. I hear a lot that one of the main reasons that people stay in dermatology is that detective piece. Everybody has that little bit of Sherlock Holmes in themselves, and dermatology seems to satisfy that.
Yeah, I don't know if it's because we're impatient and want to know right away by looking and not waiting for, I don't know, a lab test or a radiology something, but it's always really fun to just know right away. And if we don't know right away, we're pretty good at finding any way down the road.
So you mentioned the team at Saint Justine is very supportive of your research interests. Can you talk more about what you're interested in and what research projects you might have going right now?
Yeah, right now, the research project I'm doing is the PROMISE study with my best pal, Dr. Michelle Rania. I think she was on this podcast before. It's looking at the severe cutaneous blistering eruption and the drug reaction in children, a field that is evolving, especially in pediatric medicine, and a field that we can have really an impact with the discoveries and the work that Michelle started with this great multicentric project. So I'm helping the best I can here in Saint Justine because we are a big center and we have a lot of patients. The other thing is like I got into research because of my three fairy godmother, Dr. Julie Powell, Dr. Catherine McQuaid, and Dr. Daniel Marcoux, who are like since the last 30 plus years here in Montreal doing a lot of research in pediatric dermatology, especially in vascular anomalies. So I'm a part of a vascular anomaly team, so I do a little bit of research with them. And also we have a general derm practice, so we have many research interests. But beside the PROMISE study and the vascular anomaly, I'm interested right now in the vascular syndrome, or like the vasomotor changes in the hands and feet of which is kind of a benign reaction, but we saw a little bit more of vascular at the same time of the COVID pandemic. So I think there's something there to look for. But yeah, it's pretty vascular anomaly, pediatric, interesting research question that we see every day in the clinic, and yeah, the severe cutaneous blistering disorder, eruption, sorry.
So why research? Was that always a part of your career path? Did you always envision working in research in some capacity, or how did you get to research?
No, that's a good question, because when I was doing my residency, I didn't start research. It was something more to do, like with no time and over the weekend, and it seemed like a little bit um, difficult and tedious and not necessarily fun. But when you sprinkle a little bit of pediatric in there, it started to get magical and really more fun. So I think I wasn't interested in adult dermatology research, but with kids, it's funnier. And also there's I got there because it's still a young specialty, pediatric dermatology, so a lot of things needs to be yet discovered, so there's a lot of opportunity. And also um like I had my three fairy godmothers and my best pal Michelle that took me by the hand and bring me to PeDRA and to the SPD, and they did this team do this and those guys do this, and they're so fun and so welcoming, and like the group and the like I think I'm in I don't know how to say it in English, but I've been influenced really easily by dynamic ped derms people, so that's a part of the answer there.
What do you find most challenging about research?
It's it's having the time. We're working in a center where we don't have any protected time, or we can got it, but it's pretty difficult to got it and maintain it. So it's finding the time to have a clear mind and research. You cannot do that between two calls or two patients. You need to sit and think and have a couple of, I don't know, hours or maybe days, like to shape something, a research idea, to shape it in something. So the time is difficult, and also getting like the, how do you say that, the administrative support, because there's a lot of paperwork and all that. Because getting the idea for research is the first step, but after that, sometimes when I was a trainee or I'm still a young investigator, I find it a little bit like, oh, that's an interesting question, but like the first question to pop after that is like, oh, it's going to be difficult to implement and to organize. So yeah.
Time.
Time and filling the forms and doing the jumping in all the circle, in all the, I don't know what this expression, but doing all the paperwork and the step before getting to a publication and to start collecting data.
It's a lot of work to, as you said, carve out the time to just think about the project, but then having the time to jump through those administrative hoops is sometimes like you must feel like I could have done the project by now if I hadn't had to do all of this. Yeah, that can be frustrating, I can imagine.
Yeah. And sometimes we see it's easier to do less patients because like less patient because it's more easier to get the research out. But at the same time, if you want to have meaningful impact and an idea that can be generalized to all our pediatric population, we need multiple center studies, and it's another level of organization. So but the bright side of that is like with PeDRA and the SPD and all the wonderful people who are super motivated in pediatric dermatology, it helps. And you got like when you get your research out and you go in those meetings to like to talk about it, like you get like your, not your prize, but like the reward is there. Like people are so enthusiastic and people are really engaging. And yeah, so maybe when you're younger, you're like, oh, why I do that? Because you didn't get like the research out. But when it's out there, like it's really it prevent like it prevent burnout, because you get to know new colleagues and exchange idea, and like it's something really really fun.
I'm really sensing that you have a great appreciation for the collaborative nature that a place like PeDRA or the SPD offers.
Yeah, I don't know what, I'm somebody who's usually working well by himself, and usually general dermatology, maybe more in adults. Sometimes you do your thing with your team and your group, but with research, getting the collaborative work and um, the little pat in the back, or just thinking, okay, I'm working on that, but I'm not alone, because like I have other colleagues who are working right now on that, and we need to push like it's better for the motivation, like, and to like, oh, why do I have to fill this form today? So, oh, it's because I want to help the group effort. So I think it's the best thing about the PeDRA research.
That's wonderful. You talk about how being a pediatric dermatologist is rewarding. What are some of the most rewarding pieces of your job?
Getting to do a clinical examination under a chair or a table, or like dressing up for Halloween and kind of being goofy, and like everybody will be, oh wow, it's goofy and great. It's because it's great with kids, and it's like in adults you cannot do that because like, does he have like a mental disease or something if you're too happy camper? But yeah, the joy of the joy of having like young patients. The other thing on the more serious note is like, it's really rewarding because you know that you're going to impact the life of the kids you work with, and for a long time, because when you're young, you're still in development, and it's important that you achieve like the best potential. So I think every healthcare professional, every job, when we're working with children, it's something that is really, I think everybody has it in mind, because you know that you can influence and help and make them achieve their true potential, and like, and relieve some health issues, and help. So yeah, really, I see really a lot of potential in my, I see like I know CEOs and like future leader in every of my patient. Like, I tell to their parents that they can do what they want, but like, we're gonna make sure that we're gonna help them achieve whatever they want to. So
Mm. I love that you are able to be openly goofy with your patient.
everybody who's working with kids that will listen, they know that you can do like sometimes some procedure that are a little bit painful, but
Mm.
like with a smile and a sticker, or if you give candies to your patient. I don't know if you do it, but like, they're your best friend, even if you had a rough spot before with a little bit of pain. But yeah, no, they are so also in the, how do we say that, moment présent, or the kids are really in the moment.
Mm. Mm-hmm.
So it helps us to be in the moment with them, and
Mm.
makes the day go by quicker and funnier also. So yeah.
Absolutely. You've very beautifully captured, I think, the spirit of PeDRA and why we all do this, in that we are making an impact in these children's lives. And almost all of us have that story from our youth of one interaction with one doctor that we still remember. A lot of medical students I've talked to have said they've wanted to go into the field because they had a dermatologic issue themselves, or they met a doctor who really showed compassion or got under the table with them and embraced the goofiness. And I think that is first and foremost the reason we're all here and wanting to change the landscape for these children who are suffering.
And it's also very, I don't know, very inspiring that when we are in group, when we do the PeDRA and this PD and the group thing, that everybody is going in the same direction. Like, it's really motivational and energizing. Yeah.
I agree. I agree completely. And one of those ways we seem to remain energized is at karaoke at PeDRA.
Yeah. Yeah, yeah. Because like, it was a first this year at PeDRA, the karaoke night. We need to make that bigger. So yeah, I like a karaoke a lot, and I think you're a great singer too, Jen. So but for myself, I can belt a song, but my pitch is not great. So I don't think I would have a job on the voice or something like that. But looking forward to build a karaoke committee at PeDRA. Will be great.
I think you and Dr. Ramin knocked it out of the park. So before we end,
Mhm.
we're definitely going to be doing a karaoke party at the next PeDRA meeting. So are you
Great.
already working on your song list?
Yes, and I want to say to everybody who wants to join us that it's really open. We had a sad French song from me at the last edition, and also we had some, I think, telenovela Spanish song from some of our South American and Mexican colleagues. So you can bring everything you want to the table.
Well, I'm looking forward to that. I'm also looking forward to more of your wonderful research and papers coming in the future. And thank you so much for being with me today, Dr. Coulombe. It's been wonderful getting to know you.
Thank you for the invitation. And again, Happy New Year to everybody. And continue to get involved with PeDRA and continue to do research, and collaborative work is really great. Thanks.
Thank you. Thank you so much to Dr. Coulombe for joining me on Getting to Know You. It was delightful talking to him about his passions and his research. He is a great asset to PeDRA, and we so appreciate his time. For more on PeDRA Getting to Know You, follow us on Instagram and Twitter at PeDRA Research. You can also like and subscribe to our YouTube channel at the Pediatric Dermatology Research Alliance. And if you'd like to be interviewed for Getting to Know You, email me at info@pedraresearch.org. We'll see you next time.